It's 6:47 in the morning. A man walks into his kitchen. He's 63 years old, retired, reasonably healthy, or at least that's what he tells himself. Before he makes his coffee, before he checks his phone, before he does anything else, he opens a small plastic pill organizer sitting on the counter. Monday, Tuesday, Wednesday, each little compartment full. He takes one white tablet for his cholesterol, a small blue one for his blood pressure, and one more, the one his urologist prescribed 3 years ago for his prostate. He shakes them into his palm, swallows them with half a glass of water, and moves on with his day. He's been doing this exact routine for 6 years. His last blood test came back fine. His doctor is happy. His numbers look good on paper. But here's what nobody has told this man: something is happening inside his body that his blood test will never show. Something that explains why he's been waking up tired even after 8 hours of sleep. Why his legs feel heavy on the stairs. Why his mind doesn't feel quite as quick as it used to. Why he's been feeling, in a way he can't quite name, less like himself. By the end of this video, you'll know exactly what that is. And more importantly, what you can actually do about it today. Before we go any further, I want to say something clearly. I am not here to tell you to stop taking your medication. That would be dangerous, and it's not what this video is about. The medications we're going to talk about today are prescribed for real reasons. They prevent heart attacks, they lower stroke risk, they manage symptoms that affect quality of life. For many men, they are genuinely life-changing. But, and this is the part that most doctors don't have time to explain in a 12-minute appointment, these medications have effects on your body that go beyond what they're prescribed to do. Effects on your energy, your muscles, your brain chemistry, and your sense of vitality that most men chalk up to just getting older. We're going to go through the three most common medications men take after 60. We'll look at what the research actually says, and I'll show you one simple action you can take after watching this, a conversation that could genuinely change how you feel every single day. Stay with me, because the third medication on this list, the one most men are least likely to bring up with their doctor, is the one that matters most. Let's start with statins: atorvastatin, rosuvastatin, simvastatin. If you're a man over 60, there's a very good chance one of these is in that pill organizer. And statins do something genuinely important. They lower LDL cholesterol. They reduce the risk of heart attacks and strokes. This is not in dispute. The cardiovascular evidence is strong. But here is something that often gets left out of the conversation. Statins work by blocking a specific enzyme in the liver, one that helps produce cholesterol. But that same enzyme also helps your body produce something called CoQ10, coenzyme Q10. And CoQ10 is essentially the fuel source your muscle cells use to generate energy. Research published in peer-reviewed journals confirms that statin use is associated with lower levels of CoQ10 in muscle tissue. And the most common side effects patients report: muscle soreness, fatigue, weakness, a feeling of heaviness in the legs, are consistent with this mechanism. Now, I want to be precise here because accuracy matters. Not every man on a statin experiences these symptoms. The evidence on supplementing CoQ10 to address them is mixed. Some trials show benefit, others do not. What is clear is that statin-associated muscle symptoms are a real, documented phenomenon that affects a meaningful number of people. I had a patient, a 66-year-old, who had been on a statin for 4 years. He came to me not because of any dramatic symptom, but because he'd quietly given up his evening walks. He told me he just didn't have the energy anymore. He assumed it was age. After a thorough evaluation, we worked with his cardiologist to switch him to a lower dose of a different statin, one with a different side effect profile. Within 2 months, he was walking again. The key message here is not that statins are dangerous. It's that they are not a set it and forget it prescription. If you are on a statin and you've noticed unexplained fatigue, muscle heaviness, or a general drop in physical stamina, that is worth a conversation. Ask your doctor whether your current dose is the lowest effective dose. Ask whether switching to a different statin might reduce your symptoms. These are legitimate clinical questions, and you have every right to ask them. Now, the second medication, And this one affects something that most men would never connect to a pill they take for their heart. I want to tell you about a man named Raymond. Raymond was 67 years old, a former engineer, sharp his whole career, the kind of man who could hold complex problems in his head and work through them methodically. He came to see me not because he felt sick, but because he felt different, slower. He'd walk into a room and forget why he went there. He'd start a sentence and lose the thread halfway through. He was convinced something was seriously wrong with his memory. He'd been on a high dose beta blocker for his blood pressure for 4 years. Now, blood pressure medication, and beta blockers specifically, are important drugs. Uncontrolled high blood pressure causes serious damage to the brain, kidneys, and heart over time. Managing it is not optional for many men, but here is what research published in peer reviewed cardiology and neurology journals shows. Some beta blockers are lipophilic, meaning they can cross the blood brain barrier. And once inside the brain, they block receptors in ways that can, in some patients, produce neuropsychiatric side effects, including fatigue, low mood, sleep disturbances, and a slowing of mental processing speed. This is documented in the medical literature. It does not happen to everyone, but it happens to enough people that it's worth knowing about. We didn't diagnose Raymond with dementia. Working carefully with his cardiologist, we transitioned him to a different class of blood pressure medication, one that does not cross the blood brain barrier as readily. His blood pressure stayed controlled, and within 3 months, he told me it was like someone had lifted a glass wall from in front of his face. His brain hadn't changed. His medication had. If you are on blood pressure medication and you've noticed changes in your mental sharpness, your sleep quality, or your general energy level since starting it, please do not dismiss that as aging. Bring it up with your doctor. Ask whether an alternative might suit you better. That conversation is worth having. And now, the third medication, the one I mentioned at the beginning, the one men are least likely to talk about, but the one that, in my experience, affects quality of life in the most personal and profound way. If you take medication for an enlarged prostate, for BPH, this section is for you. There are two main classes of drugs used for this: alpha blockers like tamsulosin, which help relax the muscles around the prostate and bladder to make urination easier, and 5-alpha reductase inhibitors, finasteride and dutasteride, which work by reducing the size of the prostate itself over time. For urinary symptoms, both can be helpful. That is real. That matters. But the 5-alpha reductase inhibitors work by blocking the conversion of testosterone into a more potent form called DHT. And DHT doesn't just affect the prostate. It plays a role in brain chemistry, in mood regulation, in libido, and in a man's overall sense of vitality. The FDA, the United States Food and Drug Administration, updated the official labeling on these medications to include warnings about depression, sexual side effects that may persist even after stopping the drug, and in some cases, suicidal ideation. These are serious warnings, added for a reason, based on data from real patients. The research on the frequency and severity of these effects is still evolving. Not every man experiences them, but enough do that this is a conversation worth having, and one that, in my experience, most men never have with their doctor. I want to tell you about a patient I'll call George. George was 69. He'd been on finasteride for 3 years. His prostate symptoms had improved, but something else had changed. He described it as flat. He wasn't sad exactly. He just didn't feel joy the way he used to. His interest in intimacy with his wife had faded. He felt disconnected from everything that used to matter to him. He'd mentioned it to his regular doctor, who told him this was a normal part of aging. It wasn't normal aging. It was a recognized, documented, FDA-labeled side effect of the medication he was taking every single day. We worked together to explore alternatives, including whether his prostate size still warranted this class of medication and whether different management strategies were appropriate for his situation. The outcome was positive, but only because he finally said something. If you are on a prostate medication and something has shifted, your mood, your motivation, your intimate life, you are not imagining it and you are not alone. Write it down. Bring it to your next appointment. You deserve that conversation. But here's where it gets more complex, because the issue isn't just any one of these medications. It's what happens when you take all of them at the same time for years. Think back to the man I described at the beginning of this video, the one at the kitchen counter, 3 pills in his palm. He's not unusual. Research published in academic journals on aging and healthcare shows that over 40% of adults aged 65 and older regularly take 5 or more prescription medications simultaneously. That phenomenon has a name in medicine: polypharmacy. And polypharmacy creates a problem that is separate from any single medication's side effects. Medications interact. A statin and a beta blocker together can amplify muscle fatigue beyond what either would cause alone. Prostate medications can interact with blood pressure drugs in ways that affect cardiovascular regulation. Some combinations affect how drugs are metabolized by the liver, meaning a dose that was correct a year ago may produce a different effect in your body today. Research consistently associates polypharmacy in older adults with higher rates of fatigue, falls, cognitive complaints, depression, and reduced quality of life. This is not because the individual medications are wrong, it is because the combination, the cumulative burden on an aging body, is rarely reviewed as carefully or as regularly as it should be. There is a clinical tool for this. It's called a medication review. It is exactly what it sounds like: a dedicated appointment where you and your doctor go through every medication you take, assess whether each one is still the right drug at the right dose for who you are today, look for interactions, and make adjustments. You can ask for one. You are entitled to ask for one. Here is the question I want you to sit with. When was the last time you and your doctor went through every single medication you take? Not just to renew the prescription, but to genuinely ask, is this still the right approach for the person I am today? Not who you were 3 years ago, today. And there's one more layer to this, because underneath the fatigue, the brain fog, the muscle weakness, there is a system in your body that connects all of it. A system most doctors never check in men over 60. We haven't talked about it yet. And it might be the most important one. Let me bring everything together. The 3 most common medications men take after 60, statins, blood pressure drugs, and prostate medications, are not inherently harmful. For many men, they are the right choice. They prevent serious illness, they extend life, but they have real documented effects on how you feel every day, on your energy, your muscles, your thinking, your mood, that deserve to be monitored, discussed, and reconsidered over time. Statins can be associated with muscle symptoms and fatigue in some patients, potentially through effects on CoQ10 levels in muscle tissue. If you're experiencing unexplained tiredness or muscle heaviness, it's worth discussing whether your current statin and dose are still optimal. Certain blood pressure medications, particularly lipophilic beta blockers, have been associated with neuropsychiatric effects in some patients, including cognitive slowing and fatigue. If your thinking has felt slower since starting one, that connection deserves attention. 5 alpha reductase inhibitors for the prostate carry FDA labeled warnings about depression and sexual side effects. If your mood or intimate life has shifted since starting one of these drugs, you are not imagining it, and you have every right to raise it with your doctor. And if you are on multiple medications simultaneously, which most men over 65 are, the cumulative effects on your body deserve a regular, dedicated review, not just a prescription renewal, a real conversation. Here is the one thing I want you to do today: write down every medication you currently take, every single one. And next to each one, note any change in how you felt since starting it: your energy, your thinking, your mood, your physical strength, your sleep, your intimate life. Bring that list to your next appointment, not as a complaint, as information, as a partner in your own healthcare, because that is exactly what you have the right to be. If this video gave you something useful, something you didn't know or hadn't considered, please share it with one man in your life who needs to hear it. And subscribe if you want to keep getting information like this: clear, honest, and grounded in real evidence. But before you go, I need to tell you about one more thing, because there's something happening underneath all of this, beneath the fatigue, the brain fog, the muscle loss, that connects every single symptom to one specific system in your body. A system that most doctors never check in men over 60. And when it's not functioning correctly, every medication becomes less effective and every symptom becomes harder to reverse. That system is your gut. Specifically, your gut microbiome, the trillions of bacteria living in your digestive tract that regulate everything from your immune system to your brain chemistry to how effectively your medications are actually absorbed and processed by your body. Research is now showing that long term use of some of the most common medications men take after 60, including the ones we discussed today, can alter the gut microbiome in ways that affect energy, mood, cognitive function, and cardiovascular health. It's a connection that almost never gets discussed in a standard appointment. And in the next video, we're going to go deep on exactly what's happening and what men over 60 can do about it. I'll see you there.